prevalence and incidence in the American population. It is the belief at EndoBalance that exercise intensity and frequency should only be increased as organ health improves due to the eustress properties of exercise on the body.
In addition, the practitioner must understand that exercise is the fitness and athletic population's primary engagement tool. But in wellness programming, it is always second to the dietary and lifestyle recovery practices.
To summarize, a practitioner would want to use exercise recommendations to establish a new lifestyle design and help to maintain a follow-up engagement process.
Next, we examine some of the specific ways exercise can improve the wellness client's LVA indexes. Longevity markers are improved through better blood sugar management, reduced blood pressure numbers, increased bone density, and increased cholesterol particle sizes. Vitality markers are increased through adding lean muscle mass, improved general strength, endurance, and mobility, and in addition, reduced orthopedic pain. Aesthetic markers are improved through better posture, muscular symmetry, and an increased muscle-to-fat ratio.
We next look to examine the 4 major components of exercise program design. We begin with the aerobic exercise component. Aerobic refers to the use of extended oxygen-consuming activities during physical activity. Aerobic recommendations are utilized to start new clients and to raise their baseline level of cardiovascular function.
Anaerobic recommendations are utilized to create lactic acid and muscle tissue breakdown. This intense stress facilitates growth hormone production and other increases in anabolic hormones throughout the body. Anaerobic exercise is most associated with cardiovascular or resistance training modes. Anaerobic work intensities are higher than aerobic intensities, beginning around 85% and ending at one's maximal target heart rate. During this time frame, the needs of muscle metabolism for oxygen exceed the capacity of the circulatory system to meet demand, thus creating metabolic byproducts that diminish muscular contraction and reduce continued exertion. Anaerobic recommendations are utilized to create lactic acid and muscle tissue breakdown. This intense stress facilitates growth hormone production and other increases in anabolic hormones throughout the body. Thus, increases in anabolic hormones raise basal metabolic rate through repairing, rebuilding, and creating new muscular, neurologic, vascular, and bone tissues.
Lastly, flexibility exercise is usually relatively low to moderate intensity. However, depending on the position and the time under load, the intensity can quickly increase in a client's program. Flexibility recommendations are utilized to improve kinetic chain function and promote musculoskeletal recovery. We next examine physical capacity data collection. We begin with grouping 1, basic vitals used to assess client longevity. This data primarily relates to overall factors that could alter hormonal status and negatively impact cardiovascular and immune function.
Grouping 2. Vitality is used to assess client physical capacity. This data is used to clarify musculoskeletal function and capacity.
And the final grouping, aesthetics, used to assess and classify anthropometric data. This data primarily describes body composition and muscular symmetry. It can also reveal to practitioners the impact of chronic stress and overall daily behaviors on the body. Let's now look at the anthropometric endocrine relationships. We can begin with the adrenal glands. The adrenal glands are paramount in stress regulation. When clients are pushed that have high chronic stress levels, cortisol can become dysregulated and connective tissue can break down further. Thyroid gland is the second endocrine organ. The thyroid is important in protein and mineral metabolism. It is common to see poor muscle tone and decreased muscle mass in individuals who have extended thyroid dysregulation. Up next, the pancreas, which produces insulin to regulate energy production and fat metabolism when dysregulated, often creates fat deposits in the love handle, oblique, and low back areas. Liver dysregulation can manifest itself as a potbelly appearance with thinner than average arms and legs. And finally, the male and female gonads produce hormones that regulate tissue regeneration and reproduction. Under excessive stress, weight gain near the hips and lower pubic areas can ensue, as well as atrophy of female breast tissue and gynecomastia in men. As practitioners work to improve the aesthetic indices in clients, they will first need to establish ideal glandular communication and function when designing wellness exercise programs. One can see the heavy involvement of multiple endocrine glands as clients become dysregulated and fat collection occurs. Let's now move on to the metric relationships to program recommendations. These slides are a summary of how we at EndoBalance look at data related to physical classification for the wellness client.
As we examine the recovery index, we see that it's a combination of client digestion, adrenal, thyroid, and survey questions combined with blood pressure differential, A1C, CRP value, RDA-based food grouping, waist circumference, and BMI. For clients who need to increase their recovery index, we recommend a plan that focuses around improving posture and increasing mobility.
The fat burning index is a combination of client digestion, adrenal, liver, pancreas, thyroid, and gonadal survey questions, along with body fat, waist circumference, waist-to-hip ratio, neck circumference, and BMI. For clients who need to increase their fat burning index, we recommend a plan that focuses around improving lean body mass and lowering blood sugar through diet and appropriate cardiovascular exercise.
The performance index is a combination of client adrenal, liver, gonadal, and digestion survey questions combined with body fat, BMI, and the physical capacity test. For clients who need to increase their performance index, we recommend a plan that focuses around improving lean body mass, increasing mobility, improving strength, and cardiovascular capacity.
Lastly, we examine the aesthetic index, which is a combination of client adrenal, liver, thyroid, gonadal, and digestive survey questions, along with body fat, BMI, and all of the anthropometric ratios. For clients who need to increase their aesthetic index, we recommend a plan that focuses around increasing lean body mass and improving overall posture.